Hi, this is Kartik Ananth and Reuben Chen. We're from the Pacific Pain and Wellness Group, and we wanted to invite you to visit our site and visit our offices. But today is a special thing. We wanted to talk about stem cell treatment, which is something we do at the office. And again, so Reuben Chen has been with us, wow, almost 5, 6, 7 years now. So
Yeah, it's 7 years.
so Reuben, tell us, well, first of all, tell us a little about yourself.
So I am a physical medicine and rehabilitation doctor, PMNR, and what that does is it's a medical specialty that focuses on functional health. So anything that limits your ability to move, limits your ability to operate, think, and that involves a lot of pain management, involves a lot of sports medicine, and I do see some brain injury, spinal cord injury, those type of things.
And so what got you interested in stem cells from your training?
Well, stem cells are very interesting. That is, I feel, the cutting edge of medical science. Right now, I think that a lot of medicine, especially when it comes to pain management, is either covering the pain or removing the areas that cause pain. For example, uh, if you have knee pain and you have some arthritis, it's very common to just cut away maybe at the meniscus if the meniscus is torn, or to get a knee replacement. And there hasn't been as much focus on regenerative therapies, even though there has been so much research involved into how to regenerate the tissues inside injured joints so that people can live longer with their existing joints instead of immediately going to removing pieces or using medications that actually may damage the joint in the long run.
So that, along with platelet-rich plasma, is something we do here at the clinic. So can you talk a little bit about platelet-rich plasma?
Yeah. So platelet-rich plasma is very interesting. One of the things that's awesome about platelet-rich plasma is that it originates from the patient's own body. So you never use anybody else's platelet-rich plasma. And what it is we take some of the blood from the patient, and then we spin it down and separate out very specific growth factors inside the blood. We concentrate it and then we inject it into specific areas of either pain or damage. PRP is an excellent way to treat injured ligaments. It can also help to treat some mild forms of arthritis. It's used in a lot of research for treating back pain, very specific types of back pain as well. So it's a great way, and it's very, very low. It's not as invasive as maybe other stem cell treatments are, and it is pretty much as safe as you can get because you know that there's not going to be any rejection because the PRP or platelet-rich plasma originates from the patient themselves.
So Ruben, can you explain how stem cell differs from platelet-rich plasma? Because I think the viewers probably are hearing regenerative treatment. They know regenerative treatment is both PRP and stem cell.
Yeah.
So they may want to understand a little bit of why or how PRP is different than stem cell, which comes from our bodies too.
Yeah, and I get that question a lot. What is stem cell? What is PRP? PRP, if I was going to make a comparison, and let's use an example of knee pain. If I use PRP for knee pain, usually it is what I think of as a very, very great glue that helps glue damaged tissue either together or sort of smooth it out. So if you come and you have maybe a tear in your meniscus, PRP would be really good for that because the meniscus may be uh, folding up, and then you can sort of help smooth it out and help the pieces heal back together with PRP. But if those pieces are gone because of wear and tear, The PRP can't bring that back together. What it needs is actual building blocks to help increase that girth, those missing cells, and that's where stem cell comes into play. Stem cells are also great in that much of what's the most effective actually originates from the patient themselves. There's two types of stem cells that we like to use here. One of them is adipose-derived stem cells, or stem cells deriving from your fat, and the other is bone marrow-derived, or stem cells coming from the bone marrow, or your bone marrow. And each one is a little bit different depending on what you are treating, and we can help you decide which one is the best for you. But stem cells typically are there to help repair things once that material has gone and maybe worn away over time, and you need something that it can not only help heal the area but bring more tissue into that area.
So thank you for that explanation. I think one of the things that a lot of people want to know as well, they hear about all these different treatments, they sound really invasive. Um, what are the risks and benefits of these things?
Well, like with any treatment, obviously there's always going to be a risk of infection. There's risk of death, although I've actually have never seen it. But there's always those risks for any kind of treatment. But those risks are actually quite low. In fact, using PRP and stem cell, because it is your body and we are isolating specific growth factors and healing factors in your body, risk for things like infection end up to be actually much lower, I think, than other types of surgeries that may be quite invasive. PRP is probably going to be the least invasive because that just involves like a needle poke and drawing some blood, which is pretty commonplace, and then the injection into whatever area. The most common risk factors with that one are probably going to be localized pain. As you do an injection, and one of the issues with PRP or even stem cell is that it does one of the one of the mechanisms that the body tells itself to heal itself is by increasing inflammation and pain in that area. So that is probably the greatest risk factor that people have, is increased pain after an injection. And if that's the case, we usually provide some pain medicine for that short term, but that's probably going to be the worst. Usually the pain lasts anywhere between a couple days to maybe a week. And then after that inflammation goes down and that initial pain goes down, patients typically say they respond very well. They feel much better, much looser. With PRP, you can start feeling pain relief in the first 2 weeks. With stem cell, since that is a process of stabilizing and regrowing some tissue, it may take anywhere between 1 to 2 months before the patient starts to feel more relief. And then that actually continues to get better for maybe up to 6 months to a year.
Can you give us some examples of what areas of the body we can treat?
For PRP, probably the most well-recognized areas and well-researched are going to be like elbow and ankle pain. That's probably going to be the most common because they have very large ligaments there. But PRP can be used very successfully for hip, for shoulder pain. Like I mentioned before, very, very specific types of back pain as well. For stem cell, if you were talking about adipose stem cell, that's probably going to be, it ends up to be a little bit thicker. So we're going to be looking at maybe more load-bearing joints. So like hip and knee pain are very, very common for adipose-derived stem cell. For bone marrow stem cell, it's a little bit thinner, so it can go into different types of joints, so shoulder pain. It can also be used in the spine as well. So those are some of the areas that you're probably going to be looking at, the spine, shoulders, It can also be used, maybe bone marrow can be used some inside the wrist, depending on the severity of the arthritis. PRP can also be used in those areas as well.
Awesome. And everybody's hearing a lot about stem cells nowadays.
Mhm.
And we often hear about it in terms of research. Where do you see all of this headed in the future?
Well, I actually am talking with all kinds of researchers, and there is great research right now on like on the precipice of getting mainstream. I actually feel that from our experience that PRP and stem cell are quite mainstream. A lot of our patients come and ask us directly about it. But I think that going into the future, with all of the new research out there that's in what I would call regenerative therapies, where the body helps to regenerate itself and replace damaged tissue, I think that moving forward, you're going to see a lot more research in this area. Already, there's a lot of research, and I think that this is going to be the future of where medicine is going.
And I agree. I think that we're just scratching the surface.
Hmm.
It's going to be a matter of what's called precision medicine going forward,
Yeah.
where I think that we're going to find innate abilities within the body itself to fight off different disease-causing states, and also help regenerate areas that have been worn out.
Yeah, I mean, in all areas of medicine, not just pain medicine, they're realizing that there are ways to help stimulate the body's natural healing mechanisms already. You can see it in different types of medications in rheumatology for autoimmune disorders, um, allergies. So there's all kinds of things right now. Neurology, I know neurology is looking into using different types of stem cells to help with certain neurological disorders. So I think that stem cell and regenerative medicine is going to be the wave of the future for all of medicine, not just for pain management.
I agree. I agree. Well, with that said, thank you, Dr. Chen, for
Yeah.
this fabulous talk early on in the week. If anybody has any further questions, they can always reach out to us on our website, www.pacificpaingroup.com. Another one is www.pacificstemcellprp.com. And you can call us at 310-437-7399.
Yeah.
Again,
And please call us if you have any questions. You can make an appointment and we can see you and help see if PRP or stem cell is right for you.
well, thank you very much for joining us today. Thank you, Dr. Chen, for your explanation. And
All right.
we hope to see you guys really soon.
All right. Thank you. Thank you.